Hey there, happy Monday. It's Lucas Catton, and I want to share a quick follow up on the weekend's conversation around the episode of Down with the Sickness, where we talked about the manufactured mental health crisis. And this is a story that I want to share with you real quick about insurance companies specifically, and not just any insurance company, but the largest insurance company, which you can find out very quickly for yourself. And it's actually the largest healthcare company in the country and I believe the world. And this was about a conversation that I had with someone very high up in their HR department for their own employees. They have 200,000 employees roughly. And this company, if you're familiar with what's happening in healthcare, then you'll know that these companies are vertically integrated, meaning they not only own commercial insurance, but they also own insurance that provides managed care for Medicaid and Medicare, and they own pharmacy benefit managers, and they own, or PBMs as they're called. Mark Cuban's real big on this. They own provider groups as well, and things like that. So there's tons of companies that they own that's part of the larger company. And this is just a perfect example of why I know that they are not designed to do what's best for the people they serve. They are designed to pay attention to the margins and return the most for their stockholders, the shareholders. That's it. That's what publicly traded companies do. They're judged by their market cap, and they're judged by how much they're returning or how much value they're bringing to their shareholders. And I had this conversation just months after something very tragic happened to a very senior person within this organization, and this HR person that I was talking to admitted to me, and this is how you know that the people are generally good within the companies. It's very different from what the company's purpose is, even if they have individual purpose of doing well and they think they're helping people and things like that. I get it, but she admitted to me that even within their and among their own staff, she said, I know what you're talking about works. I was talking to her about Inovia at the time. And she said, I know that would be amazing. And I know that our employees would really love something like this. And I know that the people that we serve ultimately, through the insurance arm of our companies too, would really benefit from something like this. She said, in fact, our employees started creating our own facilitated sessions, our own support groups, our own peer organizations to help each other through what we're going through the loss of the high profile person, and through the amount of public scrutiny. And there's lots of fear and chaos going on within the company and things like that, turnover, lots of uncertainty, things like that. And so they started organizing and supporting each other in a subclinical way. Imagine that. When they have plenty of their own therapists to go to, plenty of their own, whatever, because they own lots of different things. But they knew that was a way to get immediate help and resources. And even despite that, despite that admission, the company itself, they would rather send people to higher cost clinical services because that's where they make the most money, whether they need it or not. Even though a simple, knowing, caring conversation with another human being who understands is going to get them more and get them help immediately in most cases than waiting to schedule an appointment to go talk to somebody else for an hour and then doing the same the next week or 2 weeks later or a month later or whatever. Right now, as often as possible. And they're like, no, that would cut into our profits. Why would we do something like that? So there you go.